Joining us from the science side now is Dr. Amesh Adalja. He's a senior scholar at the Johns Hopkins University Center for Health Security. Dr. Adalja, it's really nice of you to come back and be with us tonight. Thank you for making the time.
Sure. Thanks for having me.
Let me ask you about the antibody testing news from CDC. We had been worried about antibody testing because the FDA allowed lots of so-called antibody tests to go to market without them having to prove their efficacy to the FDA before they started being basically pushed on the American people. Now, is the CDC just warning us that, hey, there's a lot of garbage tests out there? Or are they telling us that antibody testing per se is problematic, that we're using it for things we shouldn't be using for, and that we shouldn't see any certainty in those results?
A little bit of both. What happened was that many tests were released on the market, and maybe about a dozen of them actually had good specificity. Because remember, this is the 7th human coronavirus that we've discovered, and 4 of them are out there all the time causing common colds. And there was a lot of cross reaction. So you could get a positive test, and it might not mean that you had the coronavirus. We have gotten better at figuring out which tests actually have good specificity, and those are the ones that we actually recommend to be used. The other part is, do we know what that antibody means? We believe that there is some level of immunity that's conferred once you're infected, and that you're likely immune for some period of time, but we haven't done what are called the natural history studies to know how much antibody you need to have be protected and how long that antibody lasts. So we can't really operationalize antibody tests in order to tell people it's safe to do this or safe to do that. We're trying to understand what that level would be, but we're not quite there yet. So we can't use them in those at that decision-making level yet.
Given what you just described and those dynamics at work, both about interpreting what an antibody test means, how reliable that test result is, and what its implications are for your future life and your potential susceptibility to infection or reinfection. Do you expect that antibody testing will, in the future, become a more valuable part of our response, that we will have better tests, that we will have tests that tell us more reliably whether or not we really have antibodies, and that will give us information that we can use in terms of determining whether we have any increased or decreased susceptibility to the virus?
I do think we will get there. It's going to take some time. This is a new virus. We haven't followed people who've been infected out long enough to see what their antibodies mean for them, what other parts of the immune system are important as well, what level of antibodies are necessary to confer protection, and how they decline over time. We will get there, but I don't think that we can operationalize the use of antibody testing for public policy decisions at this point. They do give us an idea, if you're using a good test, if someone's been infected, and that may be important from an epidemiological standpoint to understand where a given region is on an epidemic curve, but you can't operationalize it and say, this is safe for you, this is not safe for you.